Hello everyone, welcome back. We're at the last section of this lecture. This lecture being the vascular development in the cardiovascular system. We are talking about the circulatory changes that occur before and after birth. In this section, we'll be talking about fetal circulation as well as the adult circulation. We'll see what are the various changes that occur when a child adapts, when a fetus becomes a child and adapts from intrauterine to extrauterine life. So, fetal circulation. So, first of all, before birth, blood from placenta is 80% oxygenated. In this figure, this is the oxygenated blood in red that is being carried from the placenta through the umbilical vein into the fetus. So it is 80% oxygenated. It returns via the umbilical veins. These are the umbilical veins. It returns to the mother. On approaching the liver, most of the blood passes through the ductus venosus. This is the ductus venosus, which is a direct channel which bypasses the liver. It goes directly into the inferior vena cava. Here it goes directly within the inferior vena cava and short circuits the liver. There's a small percentage that enters the sinusoids and is mixed with the blood of the portal circulation. So moving on, there's a sphincteric mechanism in the sinus venosus which covers the entrance of the umbilical veins. It regulates the flow of umbilical blood through the hepatic sinusoids. It closes when the uterine contraction renders the venous return too high. It prevents sudden overloading of the heart. So this sphincteric mechanism is there so that the fetal heart may not be overloaded with sudden gush of blood. So moving on, the blood enters the right atrium. Here the blood is entering the right atrium. From right atrium, it is guided towards the oval foramen by the valve of inferior vena cava. So the blood that enters the right atrium, it enters into the oval foramen through the and is guided by the valve of the inferior vena cava. Now it enters directly into the left atrium. This is the area of the left atrium where it is supposed to enter directly. Now blood from the left atrium enters the left ventricle, and from left ventricle the ascending aorta. This is the ascending aorta. Now blood first enters the carotid and the coronary arteries. Carotid arteries and the coronary arteries are the first to get blood as the blood enters into the ascending aorta. Now the desaturated blood from the superior vena cava by way of the right ventricle enters into the pulmonary trunk. So the desaturated blood from the superior vena cava by way of the right ventricle, it enters the pulmonary trunk. So most of the blood passes through the ductus arteriosus into the descending aorta. So the blood that enters the pulmonary trunk, it passes through the ductus arteriosus and it goes into the descending aorta rather than going into the lungs. Through descending aorta, the blood now moves through the umbilical arteries to the umbilicus. Here the blood is going downward through the descending aorta, through the common iliac artery, through now into the umbilical veins and umbilical arteries, and via the umbilical arteries to the mother, into the umbilicus. Now the important blood mixing sites, there are 4 to 5 blood mixing sites. The liver is an important site by mixture with a small amount of blood that returns from the portal circulation. Now the inferior vena cava also carries deoxygenated blood from the lower limbs, kidneys and the pelvis. Hence the oxygenated and the deoxygenated blood in the fetus are being mixed in the inferior vena cava. The right atrium, this is the region of the right atrium. Mixture of blood with this is the region of the right atrium. The right atrium, the mixture of blood from head and upper limb occurs, because deoxygenated blood from the upper limb and the head comes from the superior vena cava. Now the left atrium by mixture with blood returning from the lungs. So some blood that has actually gone to the lungs is now coming back, and is being poured into the left atrium and is responsible for mixing of blood. And the entrance of ductus arteriosus into the descending aorta, into the aorta, is also responsible for the mixing of blood. So 5 important sites: the liver, the inferior vena cava, the right atrium, the left atrium, and the ductus arteriosus. Now, what are the circulatory changes that occur at birth? So what happens is there's cessation of the placental flow. So this was the placental flow which was actually occurring before. Now there's cessation of the placental flow, blood flow. Child begins respiration. Obviously, the lungs expand, respiration starts. As a result of respiration, the ductus arteriosus now closes. This is the ductus arteriosus, which is a communication between the pulmonary trunk and the aorta. This closes, and how does it close? By the muscular contraction of its wall due to decrease in oxygen tension. The amount of blood flowing through the lung vessel increases rapidly. Since the ductus arteriosus has closed, now the blood that was supposed to go to the lungs is actually going to the lungs. So the blood flow through the lung vessels, it increases very rapidly. This raises pressure in the left atrium, as a result of which the blood which is returning into the left atrium also increases, because the more amount of blood is going within the left atrium. So pressure in the right atrium decreases. Now the right atrial pressure decreases. Why does it decrease? Due to interruption of the placental blood flow. No blood is flowing to the right atrium through the placenta, so there is an interruption of the blood flow, so the right atrial pressure decreases. As a result of decrease of the right atrial pressure, increase in the left atrial pressure, the septum primum is opposed to the septum secundum, and oval foramen functionally closes. So the septum primum and septum secundum undergo apposition, as a result of which the foramen ovale is now functionally closed. So here you can see this is the patent foramen ovale. The foramen ovale has now been closed immediately after birth. This is the ductus, patent ductus arteriosus, which is now closed and constricted, so no blood can actually flow through it. There's cessation of the blood flow through the umbilical vessels because umbilicus is no longer there. Now, the closure of umbilical arteries. So by contraction of smooth muscles in their walls, the umbilical arteries undergo closure. So the smooth muscles are very capable, they undergo contraction. As a result, they close the vessels. It is caused by thermal and mechanical stimuli and a decrease in oxygen tension. So decrease in oxygen tension is a basic factor that is responsible for occlusion of these vessels that fast. So the functional closure usually takes place immediately, while anatomical closure takes about 2 to 3 months. The distal parts of the umbilical arteries form the medial umbilical ligament. These are the medial umbilical ligaments. Now the proximal part form the superior vesicular arteries. So the proximal part, they turn into the vesical arteries. So closure of umbilical vein and ductus venosus takes place. Obviously, they're not required. The ductus venosus degenerates, it becomes the ligamentum venosum here. This is the ductus venosus which degenerates and forms a ligamentum venosum. So this occurs shortly after that of the umbilical artery. So umbilical artery goes out first and then the ligamentum venosum. So continuing with the circulatory changes, after the obliteration, the umbilical vein forms the ligamentum teres hepatis. So the ligamentum teres hepatis is formed by the obliterated umbilical vein. The ductus venosus forms the ligamentum venosum. We've already talked about it. Now, the closure of ductus arteriosus, we discussed it before, we'll discuss it again because it's very important. That occurs immediately after birth due to decrease in oxygen tension. The muscular components, they contract and result in closure. Complete obliteration by intimal proliferation may take 1 to 3 months. Now, in adults, the obliterated ductus arteriosus, it forms the ligamentum arteriosum. Now, the closure of oval foramen. It is caused by an increase in the pressure of the left atrium and decrease in pressure of the right atrium, as a result of which this septum primum and this septum secundum, they come together and they are closely adherent. As a result of which this opening between these two is closed, and this is how the functional closure of foramen ovale takes place. So it is caused by increased pressure in the left atrium and decreased pressure on the right side. First breath presses septum primum against septum secundum. I have explained this. Constant apposition leads to fusion gradually. And this is how the circulatory changes take place. So there were many important circulatory changes between the fetal and the adult form of adult circulation within the human body. The most important of them were the closure of ductus arteriosus, the closure of foramen ovale, the cessation of blood flow through the umbilical vessel, the formation of median umbilical ligament, the superior vesicular artery, the ductus arteriosus being closed. All of these are very important for optimal blood flow throughout the body. If there is any defect in this closure, we can have birth defects of various categories in which mixing of blood may take place throughout the body. I hope you understood this lecture. For further such lectures, keep watching sqadia.com.